Bumetanide. Expanded lecture notes. Bumetanide is a loop diuretic. Like furosemide, it works in the loop of Henle in the kidneys. It's more potent than furosemide on a milligram-to-milligram basis. Bumetanide is stronger per dose compared to furosemide. Used for edema management. Bumetanide helps remove excess fluid in conditions like heart failure. Can cause electrolyte imbalances. Like other loop diuretics, bumetanide can affect potassium, sodium levels. Monitoring is needed for renal function and electrolytes. Careful watching is required due to bumetanide's effects. Other names. For bumetanide. 1. Generic name, Bumetanide. This is the medicine's official name. 2. Brand name, Bumex. Bumetanide is sold under this brand name. 3. Category. Loop diuretic. Bumetanide is a water pill, working in the loop of Henle. 4. Related drugs. Furosemide, torsemide, ethacrynic acid. These are other loop diuretics similar to bumetanide. Introduction to bumetanide. 1. Bumetanide is a potent loop diuretic. It's a strong, water pill that works in the kidneys. 2. Used primarily for the treatment of fluid retention, edema. Bumetanide helps manage edema in certain conditions. 3. Associated with congestive heart failure, liver cirrhosis, and renal disease. Bumetanide is used for edema in these conditions. 4. It is chemically and functionally similar to furosemide. Bumetanide and furosemide are both loop diuretics. 5. But is more potent on a per milligram basis. Bumetanide is stronger than furosemide dose for dose. Definition of bumetanide. Bumetanide is a sulfonamide-type loop diuretic that acts on the thick ascending limb of the loop of Henle, promoting the excretion of water, sodium, chloride, and other electrolytes. Bumetanide is a sulfonamide-type loop diuretic. It's a specific type of water pill. Acts on the thick ascending limb of the loop of Henle. This is where bumetanide works in the kidney, promoting the excretion of water, sodium, chloride, and other electrolytes. Bumetanide increases removal of these through urine. History of bumetanide. 1. Developed and introduced in the late 1970s. Bumetanide came into use during this time. 2. Created as a more potent and faster-acting alternative to furosemide. Bumetanide was made to be stronger and work quicker compared to furosemide. 3. Approved for medical use in many countries under trade names like Bumex. Bumetanide is sold under names like Bumex in various countries. Classification of bumetanide. 1. Pharmacological class. Loop diuretic. Bumetanide works in the loop of Henle in kidneys. 2. Therapeutic class. Antihypertensive, diuretic. Bumetanide helps manage fluid and can affect blood pressure. 3. Controlled substance. Not a controlled drug. Bumetanide isn't regulated like narcotics. 4. Pregnancy category C. Use of bumetanide in pregnancy needs careful consideration of risks and benefits. Chemical properties of bumetanide. 1. Molecular formula. C17H20N2O5S. This is bumetanide's chemical makeup. 2. Molecular weight. 364.42 grams per mole. This is bumetanide's weight in chemistry terms. 3. Chemical structure. Contains sulfonamide group. Bumetanide has this part in its structure. 4. Solubility. Slightly soluble in water. Bumetanide doesn't dissolve easily in water. Physical properties of bumetanide. 1. Form. Oral tablets, IV solution. Bumetanide comes in these forms for administration. 2. Appearance. White crystalline powder. Bumetanide looks like this in its pure form. 3. Storage. Room temperature. Protected from light and moisture. Bumetanide should be stored this way to keep it stable. Mechanism of action of bumetanide. 1. Inhibits the Na-K2Cl cotransporter in the thick ascending limb of the loop of Henle. Bumetanide blocks this transporter in the kidney. 2. Increases excretion of sodium, chloride, potassium, calcium, magnesium, and water. Bumetanide increases removal of these through urine. 3. Leads to diuresis, reduced blood volume, and lowered blood pressure. Bumetanide's effects lead to these outcomes. 4. Also causes some vasodilation. Bumetanide has a slight blood vessel widening effect. Pharmacokinetics of bumetanide. Absorption. Bumetanide has high oral bioavailability, meaning most of it gets absorbed into the body when taken by mouth, approximately 80 to 90%. Onset of action. Bumetanide starts working fast. When taken orally, it begins working in about 30 to 60 minutes. When given through an IV, it starts working in about 5 minutes. Peak effect. Bumetanide's strongest effect happens about 1 to 2 hours after taking it. Duration. The effects of bumetanide last for about 4 to 6 hours. Metabolism. Bumetanide is partially broken down by the liver. Excretion. Bumetanide leaves the body through the kidneys, renal pathway, and also through biliary pathway. Pharmacodynamics of bumetanide. 1. Dose-dependent diuresis. Bumetanide's diuretic effect depends on the dose given. 2. Greater potency than furosemide. Approximately equals 40x per milligram. Bumetanide is much stronger than furosemide per milligram. 3. Rapid reduction of preload and afterload in heart failure. Bumetanide quickly helps reduce heart workload in heart failure. 4. Affects electrolyte balance, causing hypokalemia, hypocalcemia, hypomagnesemia. Bumetanide can lead to low levels of these electrolytes. Storage and disposal of bumetanide. 1. Store at room temperature, away from light and moisture. Bumetanide should be kept this way for stability. 2. Avoid freezing IV formulations. IV bumetanide shouldn't be frozen. 3. Dispose per hospital or pharmacy guidelines, controlled access recommended due to potency. Bumetanide disposal should follow these guidelines because it's potent. Drug interactions of bumetanide. Interactions with other drugs. Aminoglycosides. Using bumetanide with aminoglycosides increases the risk of ototoxicity, damage to hearing or balance. Lithium. Bumetanide can increase the risk of lithium toxicity. NSAIDs. Nonsteroidal anti-inflammatory drugs, NSAIDs, may reduce the effectiveness of bumetanide's diuretic effect. Digoxin. Bumetanide can increase the risk of digoxin toxicity if low potassium hypokalemia occurs. Antihypertensives. Bumetanide can add to the blood pressure lowering effect of antihypertensives, potentially causing low blood pressure, hypotension. Clinical uses of bumetanide. 1. Congestive heart failure, CHF. Bumetanide helps manage fluid buildup in CHF. 2. Chronic kidney disease, CKD, or acute kidney injury, AKI. Bumetanide can be used in these kidney conditions for edema. 3. Hepatic cirrhosis with ascites. Bumetanide helps manage fluid in abdomen in cirrhosis. 4. Pulmonary edema. Bumetanide helps remove fluid in lungs. 5. Hypertension resistant cases. Bumetanide may be used for hard-to-treat high blood pressure. Use of bumetanide in ICU. 1. Rapid fluid removal in critically ill patients. Bumetanide helps remove fluid quickly in ICU. 2. Used when furosemide is ineffective. Bumetanide is an option if furosemide doesn't work well. 3. Use in patients with diuretic resistance. Bumetanide can help when other diuretics aren't effective enough. Use of bumetanide in anesthesia. 1. Not used intraoperatively as standard. Bumetanide isn't typically used during surgery. 2. But may be required. Post-op fluid overload. Bumetanide might be needed after surgery for fluid issues. 3. Pulmonary congestion. Bumetanide can help with fluid in lungs post-op. 4. Low urine output despite hydration. Bumetanide may help if urine output is low after surgery. 5. Monitor electrolytes post-op if used. Electrolytes need watching if bumetanide is used after surgery. Use of bumetanide in emergencies. 1. Management of acute pulmonary edema. Bumetanide helps remove fluid quickly in lung emergencies. 2. Emergency volume reduction in cardiac or renal failure. Bumetanide helps reduce fluid in these emergencies. 3. Adjunct in hypertensive crises with fluid overload. Bumetanide can help manage high blood pressure with fluid issues in emergencies. Administration and dosage of bumetanide. Route of administration. Bumetanide can be given orally, by mouth, or intravenously, IV. Initial adult dose. Oral, typically starts at 0.5–2 mg once or twice daily. IV, 0.5–1 mg given over 1 to 2 minutes. Maximum daily dose. The maximum daily dose of bumetanide is about 10 mg per day. Dosing details. Doses may be repeated in 4 to 6 hours depending on how the patient responds. In terms of potency, 1 mg of bumetanide is roughly equivalent to 40 mg of furosemide. Side effects of bumetanide. 1. Frequent urination. Bumetanide increases urine output. 2. Headache. Some people get headaches with bumetanide. 3. Dizziness. Bumetanide can cause dizziness. 4. Muscle cramps. Bumetanide can lead to muscle cramps due to electrolyte changes. 5. Hypokalemia. Bumetanide can cause low potassium levels. 6. Dehydration. Bumetanide can lead to dehydration if not monitored. Serious side effects of bumetanide. 1. Ototoxicity, less common than with furosemide. Bumetanide can affect hearing, but less often than furosemide. 2. Severe electrolyte imbalance. Bumetanide can cause serious changes in electrolyte levels. 3. Hypotension, hypovolemia. Bumetanide can lead to low blood pressure and low blood volume. 4. Renal dysfunction. Bumetanide can affect kidney function. 5. Allergic reactions, especially sulfa allergy patients. Bumetanide can cause reactions in people allergic to sulfa drugs. Contraindications of bumetanide. 1. Anuria. Bumetanide shouldn't be used if there's no urine output. 2. Severe electrolyte depletion. Bumetanide isn't for patients with severe electrolyte issues. 3. Hypersensitivity to bumetanide or sulfonamides. Bumetanide shouldn't be used in patients allergic to it or sulfa drugs. Precautions for bumetanide. 1. Diuretics may raise glucose. Bumetanide can affect blood sugar levels. 2. Elderly patients, risk of dehydration. Elderly patients on bumetanide need watching for dehydration. 3. Gout patients, raises uric acid. Bumetanide can increase uric acid levels. 4. Pregnant or breastfeeding women. Bumetanide use in these women needs careful consideration of risks and benefits. Advantages of bumetanide. 1. More potent than furosemide. Bumetanide works stronger per dose compared to furosemide. 2. Effective in diuretic-resistant patients. Bumetanide can help when other diuretics don't work well. 3. Smaller dose required, more potent per milligram. Less bumetanide is needed compared to furosemide. 4. Reliable bioavailability. Bumetanide is absorbed well in the body. Disadvantages of bumetanide. 1. Short duration, may require frequent dosing. Bumetanide's effects don't last long, so more doses might be needed. 2. Risk of electrolyte disturbances. Bumetanide can cause changes in electrolyte levels. 3. Potential ototoxicity. Bumetanide can affect hearing in some cases. 4. Requires monitoring, especially in ICU, renal failure. Bumetanide needs careful watching in critical or kidney failure patients. Clinical considerations. For bumetanide. 1. Monitor. Electrolytes K, Na, mg squared, Ca squared. Bumetanide affects these levels. 2. Monitor. Renal function. Kidney function needs watching with bumetanide. 3. Monitor. Fluid status. Bumetanide affects fluid balance. 4. Consider K supplementation. Potassium supplements might be needed with bumetanide. 5. Watch for diuretic resistance. Bumetanide's effectiveness can change over time. Comparison of bumetanide with other loop diuretics. Diuretics compared. Bumetanide has high relative potency. Lasts for 4 to 6 hours. It's potent with good bioavailability. Furosemide has moderate relative potency. Lasts for 6 to 8 hours. Oral absorption can be less predictable. Torsemide has moderate to high potency. Lasts longer at 12 hours, so it might need less frequent dosing. Ethacrynic acid has moderate potency. Lasts for 6 to 8 hours. It's often used in patients with allergies. Key differences. Bumetanide is potent with good absorption. Torsemide is longer acting. Ethacrynic acid is an option for patients allergic to sulfa drugs. Additional information on bumetanide. 1. Used in pediatric patients for nephrotic syndrome or heart failure. Bumetanide can help kids with these conditions. 2. Effective even in patients with low GFR. Bumetanide can work in patients with poor kidney function. 3. May be combined with thiazide in resistant edema. Bumetanide and thiazide can be used together for tough-to-treat swelling. Current trends in bumetanide use. 1. Use in outpatient heart failure clinics for volume management. Bumetanide helps manage fluid volume in heart failure patients in outpatient settings. 2. Studies exploring combination diuretic therapy. Research looks at combining bumetanide with other diuretics for better outcomes in heart failure. 3. Investigated in acute decompensated heart failure protocols. Bumetanide's role in managing acute heart failure with fluid overload is being studied. Research on bumetanide in neurological conditions. 1. Bumetanide in autism. Bumetanide, a diuretic, influences neuronal chloride homeostasis and potentially restores GABAergic inhibition and neuronal signaling balance. This mechanism may contribute to improvements in autism-related symptoms. Studies show bumetanide may alleviate symptoms in some children with autism. Bumetanide in epilepsy. Bumetanide, an NKCC1 co-transporter antagonist, may improve cognitive functioning in patients with drug-resistant epilepsy by reducing seizure frequency and affecting brain microstructural organization. 2. Use as adjunct in brain edema management. While bumetanide's primary research focus in neurological conditions is on autism and epilepsy through modulating chloride transport, its use specifically in brain edema management isn't widely highlighted in current research findings. 3. Bioavailability. Bumetanide binds to serum albumin and other proteins in the blood, reducing systemic bioavailability. It's partially metabolized by the liver and excreted in urine as both drug and metabolite. Genetic variations affecting drug response. Research suggests bumetanide's effects may vary due to its action on NKCC1, a transporter involved in chloride balance in neurons. Genetic variations affecting NKCC1 or related pathways could influence bumetanide's efficacy in neurological conditions. Conclusion on bumetanide. 1. Bumetanide is a powerful loop diuretic. Bumetanide helps remove fluid quickly. Ideal for patients needing fast and reliable fluid removal. Bumetanide works well for this. 2. It's more potent than furosemide. Bumetanide works stronger per dose compared to furosemide, but requires close monitoring of electrolytes. Bumetanide can cause changes in electrolyte levels. Requires monitoring of renal function. Kidney function needs watching with bumetanide. And volume status to avoid complications. Bumetanide affects fluid balance, so monitoring is needed. Professional quote. A small dose of bumetanide can do what large doses of others cannot, if used wisely. Dr. S. Carter, nephrologist. This quote highlights that bumetanide is a potent diuretic. A small dose can be very effective compared to larger doses of other diuretics. Dr. S. Carter emphasizes the need to use bumetanide wisely due to its potency. Thank you for watching. If you liked this content, don't forget to like to show your support. Comment and share your thoughts. Share with your friends and family. Subscribe for more exciting content. Your engagement means the world to us. Stay tuned for more.